My name is Demar. I am a third-year doctoral student at Yale University in Sociology and African American Studies. And my research focuses on connections between the phenomenon of lynching, incarceration, and policing. In the United States, we have a hard time grappling with our history. And what strikes me about that is not just the fact in and of itself, but it's the idea that in hiding from history, there are no consequences. It's the idea that in failing to acknowledge historical wrongs or traumas that have been produced, that people will be able to just adjust and adapt. And then if something changes, well, we'll just deal with the change and then pretend like nothing ever happened. But the reality is that we can't look past our history. We can't forget things that have happened, because if we continue to perpetuate the same practices that we're trying to hide from, or the same wrongs that we're trying to hide from, we're never going to get to a point where we actually can live in a world that's fundamentally different from the world that we have, that's since passed. It allows for interconnectivity across people, across place and space. It allows for interconnectivity to allow for people to exist in environments that are healthy and free of things that would threaten their life. It's a space where people have access to resources, to employment, to education, to healthcare, and other things that promote their welfare more generally. And I think in a culture of health, it's not some faraway place that can never exist, but it's a place that we have to work for, and it's a place that has to be maintained, and that people have to commit to preserving, so that it can be something that not only affects people who are alive and well right now, but generations to come. It's a culture that's grounded in principles of equity and inclusion, something where diversity is not just a buzzword, but it's an ever-present reality, and something that people can't just talk about it, but they have to actually be about it. First, I want to acknowledge, some of the academic communities that I represent, because I think it's important to do so prior to talking about how my particular work will be able to benefit a culture of health or contribute towards a culture of health. And those communities are that of sociology and African American studies, or even more broadly, the social sciences that aren't economics, and the humanities. And I think there's lots that can be gained from the perspectives of the social sciences and the humanities broadly, because we study social issues. We study the consequences of policy action and inaction. We study human experiences and how people have not only lived in the world and continue to live in the world, but how the world has been processed, and how, there's a lot that, even like, say for instance, historians study when they study culture, or when they study, or if an anthropologist is studying culture, or even people who are studying literature to try to understand how did people navigate the world, and what was it like to be in a community in the Midwest in the early 1900s. Now I think and that's just even the humanities and the social sciences. I think there's, in sociology, I think sociologists, we study organizations, we study institutions, we study neighborhoods, we study everything under the sun, and we use all methods essentially to do so. Be they quantitative or qualitative, be they historical, be they archival, be they computational. I think the real opportunity is in allowing for those of us who are sociologists and other social scientists, as well as humanists and those in the humanities, to translate what we've learned into things that can be potentially beneficial to policy. I think, and that's something that if we are going to get to building a culture of health, and anytime soon, we have to do, because we have to start from the premise that everybody knows something. Everybody has something that they can contribute that can be beneficial to this larger collective process of building a culture of health, and particularly in trying to activate and animate the research community. Because not everybody is a hard scientist, not everybody is an economist, and not everybody's a doctor, not everybody's a lawyer, and that's okay. But I think if we're trying to fully understand, the possibilities of what a culture of health can look like, tapping into communities, research communities in particular, that are underutilized and involved in policy-making processes is extremely important. So I wanted to give that shout out first, because I think, again, that matters a lot more than what I have to say. And yeah, I think just to be brief, with my particular research, it can what I hope is that my research can help to illuminate options, which are things that we all, which might allow for choices. And in creating potential options or choices around phenomena like incarceration, like policing, the people who are the actors are going to still have to, at the end of the day, make the decisions they want to make. Maybe there's something I can present to them or provide to them that can help them understand something that they didn't previously. Or maybe I say something that's not new, and I'm okay with that. But in doing that, I think it's important to realize, if there are issues that have been persisting over time, that researchers over time have been continuing to say, that have not been heeded or have not been incorporated into policymaking processes, I think that's something where policymakers are actually going to have to step to the table to do something different. Again, all in service of creating a culture of health. First and foremost, I think that HPRS is a family. I think the wonderful staff that we have done a great job, one, in helping each of us to feel welcome and comfortable where we are, but also in helping us to understand that, beyond whatever we're required to do at our individual institutions, we are each other's greatest asset. We are what's most important. And even yesterday, we were reminded that we can't leave people behind. We can't operate in a space that allows for anyone to feel that they are not a welcome part of our family. And so, to me, when I think of HPRS, I think about family. These are people who I talk to, not only are we in class together once a week, which is fine, but we talk to each other in one way or another, like every day. And when we talk to each other, sometimes we talk about things that are important, for specific projects or this or that, but sometimes, a lot of times, we just talk about life. We talk about what we're going through, what we're experiencing, and we lean on one another in whatever ways that we can, and that's important. And beyond that, I think, HPRS is it's a space where, for those of us who aspire to kind of integrate different interests, aspirations, and values that we have, it's a space where that's accepted, and that's okay, and that's encouraged. And I think to me, that's refreshing because there's very few spaces like that in the world that not only, take us as we are, but to help us be our best selves and not to try to sway us to say, you need to, go off and be the next president of the United States. You need to go and run this nonprofit organization. You're not going to cut it in this space. You better go do that. That's not what HPRS is about.